Medical Assistant Exam Infection Control Review. Question 1. An office review in an electronic health record review shows that a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A. Right color of vial and right storage shelf. Option B. Right patient, right medication, right dose, right route, right time, and right documentation. Option C. Right diagnosis only. Option D. Right insurance, right copay, right appointment, and right room. The correct answer is option B. Right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Vial appearance and shelf location are not sufficient medication rights. Diagnosis alone is not enough to confirm safe administration. Administrative details do not replace medication safety checks. Question 2. Given the workflow in a medication administration visit, a complete blood count is ordered. Which tube is most commonly used? Option A. Gray tube with fluoride oxalate. Option B. Lavender tube with EDTA. Option C. Light blue tube with sodium citrate. Option D. A red tube with no anticoagulant. The correct answer is option B. Lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. Gray tubes are used for tests such as glucose or lactate depending on protocol. Sodium citrate is used mainly for coagulation studies. A red tube allows clotting and is not the standard choice for a complete blood count. Question 3. Given the workflow in a diagnostic testing area, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. Patient states, "I have had a cough for 3 days." Option B. No documentation is needed for symptoms. Option C. Patient is definitely exaggerating the cough. Option D. The assistant diagnoses pneumonia. The correct answer is option A. Patient states, "I have had a cough for 3 days." Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Symptoms are relevant to the visit and should be documented according to policy. Judgmental wording is inappropriate and not objective. Diagnosis belongs to the provider. Question 4. A medical assistant is working in a diagnostic testing area when an insurance plan requires approval before a specialist visit. Which process is being described? Option A. Venipuncture. Option B. Prior authorization or referral process. Option C. Autoclaving. Option D. Auscultation. The correct answer is option B. Prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Venipuncture is blood collection and does not authorize insurance coverage. Autoclaving sterilizes instruments and is unrelated to payer approval. Auscultation is listening to body sounds and does not approve visits. Question 5. In an administrative check-in area, the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A. Count respirations before locating the pulse. Option B. Use the thumb to feel the pulse. Option C. Place the stethoscope over the abdomen. Option D. Place 2 or 3 fingers over the radial artery at the wrist. The correct answer is option D. Place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. Respirations are measured separately and do not identify the pulse site. The thumb has its own pulse and can interfere with accurate counting. The abdomen is not used for a routine radial pulse. Question 6. As part of exam preparation in a medication administration visit, a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A. Tighten it further until the vein bulges. Option B. Release it and allow the arm to recover before continuing. Option C. Ignore the time because tourniquets do not affect tests. Option D. Move it over the venipuncture site. The correct answer is option B. Release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. More pressure can increase discomfort and alter specimen quality. Tourniquet time can affect certain laboratory values. A tourniquet is placed above the site, not over the puncture area. Question 7. Following office protocol in a walk-in clinic, A waived glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A. Record patient results without documenting controls. Option B. Change the patient's diagnosis to match the meter. Option C. Use the meter because patient samples are different. Option D. Resolve the quality control problem according to protocol. The correct answer is option D. Resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Quality control documentation is part of reliable testing. Medical assistants do not diagnose and should not alter clinical information to fit a device. Failed controls must be addressed before reporting patient values. Question 8. To protect safety in an exam room, office supplies are consistently running out before the next order date. Which administrative action is best? Option A. Order random supplies without reviewing use. Option B. Track usage and adjust par levels according to office needs. Option C. Hide supplies from the provider. Option D. Wait until every item is completely gone. The correct answer is option B. Track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Unplanned ordering can waste money and storage space. Hiding supplies does not solve inventory management. Waiting can interrupt patient care and office workflow. Question 9. During an infection control audit, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A. Disinfection always destroys every spore. Option B. Packaging instruments makes cleaning unnecessary. Option C. Organic material can interfere with sterilization. Option D. Sterilization is the same as hand washing. The correct answer is option C. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Disinfection reduces many organisms but does not reliably destroy all spores. Packaging dirty instruments traps contamination rather than preparing them safely. Hand washing reduces microbes on skin but is not instrument sterilization. Question 10. Following office protocol in an administrative check-in area, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A. Finish documenting the previous visit. Option B. Move the patient to a chair before assessing. Option C. Offer water by mouth immediately. Option D. Activate emergency response and assess breathing according to training. The correct answer is option D. Activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Giving oral fluids to an unresponsive patient risks aspiration. Question 11. An office review in a primary care office shows that a sterile dressing change is being prepared. Which action helps maintain sterility? Option A. Place sterile gauze on an unclean counter. Option B. Reuse sterile gloves from a previous patient. Option C. Open sterile supplies without touching the inner sterile surface. Option D. Reach across the field with unsterile clothing. The correct answer is option C. Open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. An unclean surface contaminates sterile supplies. Sterile gloves are single-use and patient-specific. Reaching over the field can contaminate it. Question 12. At the start of care in a primary care office, a patient asks which body system includes the skin. Which system should be identified? Option A. Respiratory system. Option B. Urinary system. Option C. Integumentary system. Option D. Endocrine system. The correct answer is option C. Integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The respiratory system supports breathing and gas exchange. The urinary system filters blood and eliminates urine. The endocrine system is made of hormone-producing glands. Question 13. Before the visit continues in an infection control audit, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A. Patient intake form. Option B. Appointment reminder template. Option C. Safety data sheet. Option D. Insurance remittance advice. The correct answer is option C. Safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. An intake form does not provide chemical safety instructions. Reminder templates do not address workplace chemical safety. Remittance advice explains payment decisions, not chemical hazards. Question 14. When a patient encounter unfolds in a quality control review, a patient develops hives, wheezing, and swelling after an injection. Which action is most appropriate? Option A. Schedule a routine follow-up for next week. Option B. Tell the patient to drive home and rest. Option C. Notify the provider and activate emergency protocol immediately. Option D. Ignore the symptoms if the injection site looks clean. The correct answer is option C. Notify the provider and activate emergency protocol immediately. These findings can indicate anaphylaxis and require urgent response. Potential anaphylaxis cannot be delayed for routine follow-up. Respiratory symptoms and swelling require immediate attention. Systemic allergic symptoms matter even if the injection site appears normal. Question 15. The care team in a preventive care visit asks for guidance because a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A. Reverse isolation for staph protection only. Option B. Droplet precautions only. Option C. Contact precautions only. Option D. Airborne precautions. The correct answer is option D. Airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Droplet precautions do not address smaller airborne particles that can remain suspended. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Question 16. After reviewing the situation in a patient intake station, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A. Choose the pharmacy closest to the clinic. Option B. Leave the old pharmacy because it is already in the chart. Option C. Delete all pharmacy information from the record. Option D. Update the preferred pharmacy after verifying the new information. The correct answer is option D. Update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. The preferred pharmacy should come from the patient rather than staff convenience. Outdated demographic information can delay medication access. Removing needed information can interrupt prescribing workflows. Question 17. Given the workflow in an urgent care office, a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A. Change the results so it appears normal. Option B. Tell the patient the provider will review and explain the results. Option C. Diagnose the patient based on abnormal values. Option D. Post the result publicly so others can comment. The correct answer is option B. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Changing results is unethical and falsifies the record. Diagnosis is outside the medical assistant's scope of practice. Public disclosure violates confidentiality and professionalism. Question 18. In an electronic health record review, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The machine draws blood through the wires. Option B. The electrodes inject medication. Option C. The test shocks every patient to start the heart. Option D. The test records electrical activity and does not deliver a shock. The correct answer is option D. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrocardiogram leads do not collect blood. Electrodes record signals and do not inject medication. A standard electrocardiogram does not deliver electrical therapy. Question 19. An office review in a diagnostic testing area shows that a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A. Encourage coughing and monitor closely. Option B. Perform blind finger sweeps immediately. Option C. Give the patient food to push it down. Option D. Leave the patient alone until they stop coughing. The correct answer is option A. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Blind finger sweeps can push the object deeper and are not appropriate. Food can worsen the obstruction. The patient should be monitored because the obstruction may worsen. Question 20. An office review in a patient education session shows that a peak flow test is ordered. Which body system is being assessed? Option A, urinary system. Option B, integumentary system. Option C, respiratory system. Option D, skeletal system only. The correct answer is option C, respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. The urinary system is assessed with urine tests and related procedures. The integumentary system involves the skin, hair, and nails. Peak flow does not measure bone structure. Question 21. A medical assistant is working in a certification exam scenario when the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A, hemostat. Option B, autoclave tape. Option C, Snellen chart. Option D, tourniquet. The correct answer is option C, Snellen chart. A Snellen chart is used to screen distance visual acuity. A hemostat clamps tissue or small objects during procedures. Autoclave tape indicates exposure to sterilization conditions. A tourniquet helps locate veins for blood collection. Question 22. In a busy front office, a glucose test requiring glycolysis inhibition is ordered. Which tube is commonly associated with this additive purpose? Option A, light blue tube. Option B, blood culture bottle. Option C, lavender tube. Option D, gray tube. The correct answer is option D, gray tube. Gray tubes commonly contain additives such as fluoride that help inhibit glycolysis for glucose testing. Light blue citrate is used for coagulation studies. Blood culture bottles are used to detect bloodstream microorganisms. Lavender EDTA is used mainly for hematology testing. Question 23. While working in a preventive care visit, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A, place the dressing on the clean supply tray. Option B, save the dressing in the patient's purse. Option C, use gloves and dispose of the dressing according to biohazard policy. Option D, handle the dressing with bare hands. The correct answer is option C, use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Soiled material can contaminate clean supplies. Biohazard waste should not be sent home in personal belongings. Bare hand contact increases exposure risk. Question 24. Before the visit continues in a same-day appointment, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, defamation. Option B, battery. Option C, coordination of benefits. Option D, emancipation. The correct answer is option B, battery. Battery can involve intentional touching or treatment without consent. Defamation involves false statements that harm reputation. Coordination of benefits is an insurance concept. Emancipation relates to a minor's legal independence. Question 25. For a patient encounter in an outpatient laboratory, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A, reflex hammer. Option B, centrifuge. Option C, ophthalmoscope. Option D, otoscope. The correct answer is option C, ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. A reflex hammer tests reflexes and does not visualize the retina. A centrifuge separates specimen components and is not an eye exam tool. An otoscope is used for the ear canal and tympanic membrane. Question 26. For a patient encounter in a busy front office, a used needle must be discarded after an injection. Which practice is safest? Option A, carry the needle to the front desk for disposal. Option B, activate the safety device and place the needle in a sharps container. Option C, recap the needle with both hands. Option D, place the needle in regular trash. The correct answer is option B, activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Transporting exposed sharps through the office increases risk. Two-handed recapping increases needle stick risk. Sharps can injure staff and must not go into regular trash. Question 27. Following office protocol in a family practice clinic, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A. Write only the highest number ever measured. Option B. Record readings with date, time, and relevant notes as directed. Option C. Use another person's readings if the cuff is shared. Option D. Skip technique instructions because home cuffs are automatic. The correct answer is option B. Record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Selective recording can mislead clinical decisions. Readings must belong to the patient. Proper positioning and technique still matter with automatic cuffs. Question 28. An office review in a treatment room shows that the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A. Wave scheduling. Option B. Open hours. Option C. Double booking. Option D. Clustering. The correct answer is option C. Double booking. Double booking places more than one patient in the same appointment slot. Wave scheduling schedules several patients to arrive at the beginning of a block. Open hours allow patients to arrive without exact appointment times. Clustering groups similar types of appointments together. Question 29. At the start of care in a same-day appointment, the term gastroenterology appears in a referral. Which specialty is involved? Option A. Nervous system. Option B. Endocrine glands. Option C. Urinary bladder only. Option D. Digestive system. The correct answer is option D. Digestive system. Gastroenterology focuses on the digestive tract and related disorders. Neurology focuses on the nervous system. Endocrinology focuses on hormone-producing glands. Urology focuses on the urinary tract and male reproductive system. Question 30. In a phlebotomy station, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A. Verify the allergy information and enter it clearly in the medical record. Option B. Place the form in the chart without reviewing it. Option C. Remove allergies that the patient says happened many years ago. Option D. Ask the patient to remember only prescription allergies. The correct answer is option A. Verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Important safety information can be missed if the history is not reviewed. Past reactions may still be clinically important and should not be deleted without provider direction. Allergies to over-the-counter drugs, foods, or latex may also affect care. Question 31. A medical assistant is working in an outpatient laboratory when a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A. Notify the provider or designated clinical staff promptly. Option B. Discard the result because it is abnormal. Option C. File the result for review at the end of the month. Option D. Tell the patient the exact diagnosis without provider review. The correct answer is option A. Notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Abnormal results must be reported, not discarded. Delaying a critical result can put the patient at risk. Diagnosis and interpretation belong to the provider. Question 32. For a patient encounter in a busy front office, the term otitis media is listed in the assessment. Which body area is involved? Option A. Middle ear. Option B. Stomach. Option C. Kidney. Option D. Liver. The correct answer is option A. Middle ear. Otitis media refers to inflammation or infection involving the middle ear. Stomach inflammation is gastritis. Kidney inflammation is related to nephritis or pyelonephritis. Liver inflammation is hepatitis. Question 33. A medical assistant is working in a phlebotomy station when a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Leave another patient's results for comparison. Option B. Demand payment details with full medical history. Option C. Describe the diagnosis in detail on the message. Option D. Leave limited information and a callback number. The correct answer is option D. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Sharing another patient's information is a privacy breach. Excessive information violates privacy and may not be necessary. Detailed clinical information may be heard by unauthorized people. Question 34. Given the workflow in a primary care office, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A. Send the patient home to rest without notifying anyone. Option B. Recheck using proper technique and report the finding according to protocol. Option C. Erase the value because it may worry the patient. Option D. Tell the patient that hypertension has been diagnosed. The correct answer is option B. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Abnormal readings require appropriate follow-up rather than dismissal. Accurate documentation is required even when the value is abnormal. Medical assistants do not diagnose conditions based on one reading. Question 35. While working in a phlebotomy station, a specimen label is missing after collection. Which action is best? Option A. Write a name on the tube from memory. Option B. Send the tube with no label and explain later. Option C. Follow facility policy for recollection or correction without guessing. Option D. Ask another patient if the tube belongs to them. The correct answer is option C. Follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Guessing can cause a serious misidentification error. Laboratories commonly reject unlabeled specimens. Patients cannot resolve specimen identity errors reliably. Question 36. When a patient encounter unfolds in an infection control audit, the assistant is comparing two needle gauges. Which statement is accurate? Option A. Gauge has no relation to needle size. Option B. A larger gauge number always means a longer needle. Option C. All injections use the same gauge. Option D. A smaller gauge number indicates a larger needle diameter. The correct answer is option D. A smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Gauge specifically describes needle diameter. Gauge describes diameter, not length. Needle gauge varies by medication, route, and patient factors. Question 37. After reviewing the situation in a specialty referral visit, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A. Ophthalmoscope. Option B. Spirometer. Option C. Speculum for pelvic exam. Option D. Otoscope. The correct answer is option D. Otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. An ophthalmoscope is used to examine internal eye structures. A spirometer evaluates lung function rather than the ear. A vaginal speculum is not used to inspect the ear canal. Question 38. In a cardiology practice, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A. Speak quietly and avoid announcing sensitive details. Option B. Ask other patients to help verify the record. Option C. State the full diagnosis loudly to confirm the visit. Option D. Place all charts open on the counter. The correct answer is option A. Speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Other patients should not be involved in private verification. Announcing diagnoses in public can violate confidentiality. Open charts may expose protected information. Question 39. After reviewing the situation in a specialty referral visit, the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A. Atrial depolarization. Option B. Ventricular repolarization. Option C. Kidney filtration. Option D. Ventricular depolarization. The correct answer is option A. Atrial depolarization. The P wave represents electrical activation of the atria. Ventricular repolarization is represented by the T wave. Kidney filtration is unrelated to electrocardiogram waveforms. Ventricular depolarization is represented mainly by the QRS complex. Question 40. While working in a specialty referral visit, a mask becomes wet during patient care. Which action is appropriate? Option A. Replace the mask according to infection control practice. Option B, share it with a coworker. Option C, dry it on the clean supply shelf. Option D, keep wearing it for the rest of the week. The correct answer is option A. Replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Masks are not shared between staff. Used masks can contaminate clean areas. Extended use of a wet mask is not appropriate. Question 41. A medical assistant is working in a primary care office when the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A, gallbladder. Option B, spleen. Option C, pancreas. Option D, bladder. The correct answer is option A, gallbladder. The gallbladder stores and concentrates bile made by the liver. The spleen is involved in immune and blood cell functions. The pancreas produces digestive enzymes and hormones but does not store bile. The urinary bladder stores urine, not bile. Question 42. After reviewing the situation in a telephone triage workflow, blood spills on an exam room floor. Which response follows standard safety practice? Option A. Ask a patient to avoid stepping on it. Option B. Wipe the spill with a dry paper towel only. Option C. Cover the spill with an exam table paper. Option D. Use appropriate personal protective equipment and an approved disinfectant. The correct answer is option D. Use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Patients should not be involved in hazardous cleanup. Dry wiping can spread contamination and does not disinfect the surface. Covering a spill does not remove or disinfect the hazard. Question 43. As part of exam preparation in a phlebotomy station, a sterile package is torn before a minor procedure. Which action is required? Option A. Use the items if they look clean. Option B. Tape the wrapper and use the contents. Option C. Consider the contents contaminated and obtain a new sterile package. Option D. Spray the package with disinfectant. The correct answer is option C. Consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Clean appearance does not prove sterility. Taping does not restore sterility after the barrier is compromised. Surface disinfectant cannot sterilize items inside a compromised package. Question 44. For a patient encounter in a procedure setup, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Alcohol sanitizer is always illegal in clinics. Option B. Gloves completely replace hand hygiene. Option C. Hand washing is needed only before eating. Option D. Soap and water help remove spores more effectively from the hands. The correct answer is option D. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Alcohol-based hand rubs are appropriate for many routine situations. Gloves reduce exposure but do not replace hand hygiene after removal. Hand hygiene is required at multiple points in patient care. Question 45. A medical assistant is working in a preventive care visit when the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A. Skip explanations because the patient signed in. Option B. Discuss the patient's body in the hallway. Option C. Provide appropriate draping and expose only the area being examined. Option D. Leave the patient uncovered until the provider arrives. The correct answer is option C. Provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Patients still need respectful communication during preparation. Public discussion can violate privacy and professionalism. Unnecessary exposure reduces dignity and comfort. Question 46. The care team in a specialty referral visit asks for guidance because a patient needs crutch walking education after provider instruction. Which principle is important? Option A. Crutches should fit properly and not press into the axilla. Option B. The patient should skip follow-up if pain increases. Option C. Crutches should be used only on wet floors. Option D. Body weight should rest mainly on the armpits. The correct answer is option A. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Worsening symptoms should be reported according to instructions. Crutches are mobility aids and wet floors increase fall risk. Weight should be supported through the hands, not the axilla. Question 47. To protect safety in an electronic health record review, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, fourth intercostal space at the left sternal border. Option B, left arm below the clavicle. Option C, fourth intercostal space at the right sternal border. Option D, fifth intercostal space at the left midclavicular line. The correct answer is option C, fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. That location corresponds to V2. The left arm electrode is a limb lead site, not V1. That location corresponds to V4 in standard placement. Question 48. To protect safety in an exam room, a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A, keep the surface wet for the full listed contact time. Option B, wipe the surface dry immediately. Option C, use the disinfectant only on clean hands. Option D, dilute the solution more to reduce odor. The correct answer is option A, keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Removing the disinfectant too soon can make it ineffective. Environmental disinfectants are not hand hygiene products. Unapproved dilution can reduce disinfectant strength. Question 49. Following office protocol in a patient education session, a patient is placed lying face down for a back examination. Which position is being used? Option A, lithotomy. Option B, Fowler. Option C, prone. Option D, supine. The correct answer is option C, prone. Prone means lying on the abdomen with the face downward. Lithotomy involves legs in stirrups for certain pelvic procedures. Fowler is a seated or semi-seated position. Supine means lying on the back. Question 50. While working in an exam room, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A, open the package and rinse the instruments. Option B, reprocess the instruments before use. Option C, use the instruments if the package is dry. Option D, write a new date on the package. The correct answer is option B, reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. Rinsing does not restore sterility. A dry package alone does not override an expiration policy. Changing the date without reprocessing is unsafe and misleading. Question 51. For a patient encounter in a primary care office, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A, platelet. Option B, ureter. Option C, axon. Option D, alveolus. The correct answer is option C, axon. An axon carries nerve impulses away from the neuron cell body. A platelet is a blood component involved in clotting. A ureter carries urine from kidney to bladder. An alveolus is a lung air sac. Question 52. An office review in a phlebotomy station shows that the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A, 100 mm per millivolt. Option B, 25 mm per millivolt. Option C, 10 mm per millivolt. Option D, 1 mm per millivolt. The correct answer is option C, 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That value would greatly exaggerate waveform size. That value is not the common standard amplitude calibration. That calibration would make complexes appear too small for standard interpretation. Question 53. Given the workflow in an electronic health record review, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, a properly grounded machine with still patient. Option B, poor electrode contact or patient movement. Option C, correct limb lead placement. Option D, a normal calibration mark only. The correct answer is option B, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Good grounding and stillness reduce electrical or motion artifact. Correct placement should reduce rather than create artifact. Calibration marks do not explain baseline movement during tracing. Question 54. Given the workflow in a walk-in clinic, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Place a bandage on the site and ignore it. Option B. Wash the area and report the exposure according to protocol. Option C. Finish all remaining patients before telling anyone. Option D. Hide the incident if there is no bleeding. The correct answer is option B. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. Covering the wound alone does not address exposure risk. Delaying reporting can delay needed evaluation and follow-up. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Question 55. Following office protocol in a pediatric clinic, a provider orders spirometry in the office. Which patient action is required? Option A. Talk continuously during the maneuver. Option B. Remove the mouthpiece before starting. Option C. Hold both nostrils and refuse to exhale. Option D. Follow instructions for a strong, complete breathing maneuver. The correct answer is option D. Follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. Talking interferes with airflow measurement. The mouthpiece is needed to measure airflow. The test depends on controlled breathing through the device. Question 56. As part of exam preparation in a medical office workflow, the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A. The machine cannot record any heartbeat unless the patient holds breath for 5 minutes. Option B. Movement can create artifact that makes the tracing harder to interpret. Option C. Movement changes the patient's blood type. Option D. Electrodes are used only to deliver medication. The correct answer is option B. Movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Normal breathing is usually allowed, but excessive movement should be avoided. Movement has no effect on blood type. Electrodes detect electrical activity and do not deliver medication during a standard recording. Question 57. In a patient intake station, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A. Leave the container unrefrigerated unless it smells unusual. Option B. Collect urine only when symptoms occur. Option C. Discard the first void and collect all urine for the next 24 hours. Option D. Keep only the first void and discard the rest. The correct answer is option C. Discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. Storage requirements should follow the test protocol and preservative instructions. Timed urine testing requires all urine during the collection period. A single first void is not a 24-hour collection. Question 58. While working in a pediatric clinic, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A. Trendelenburg is the only routine choice. Option B. Lithotomy position. Option C. Fowler position. Option D. Prone position. The correct answer is option C. Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Lithotomy is used for pelvic procedures and does not primarily support breathing. Prone places the patient face down and may worsen breathing comfort. Question 59. At the start of care in a primary care office, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A. Supine. Option B. Prone. Option C. Sims. Option D. Fowler. The correct answer is option A. Supine. Supine means lying on the back facing upward. Prone means lying face down. Sims position is side lying with one knee flexed. Fowler position is seated or semi-seated. Question 60. A medical assistant is working in an exam room when an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A. PA. Option B. IM. Option C. Subcut. Option D. 4. The correct answer is option A. HIPAA. PA means by mouth and is used for oral administration. IM means intramuscular and refers to injection into muscle. Subcut means subcutaneous and refers to injection into tissue under the skin. For means intravenous and refers to administration into a vein. Question 61. An office review in a quality control review shows that a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A. Use powdered latex gloves because they are easier to put on. Option B. Use latex-free supplies and clearly communicate the allergy. Option C. Tell the patient to bring personal gloves only. Option D. Ignore the allergy if the procedure is short. The correct answer is option B. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. Latex gloves can trigger a reaction in a latex allergic patient. The clinic remains responsible for preparing a safe care environment. Even brief latex exposure can cause a serious reaction. Question 62. The care team in a primary care office asks for guidance because the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A. HIPAA. Option B. ARICE. Option C. PERLA. Option D. PASS. The correct answer is option D. PASS. PASS stands for pull, aim, squeeze, and sweep. HIPAA governs health information privacy and security. RICE refers to rest, ice, compression, and elevation for certain injuries. PERLA describes pupil assessment. Question 63. To protect safety in an internal medicine office, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Using sterile forceps for sterile supplies. Option B. Opening the wrapper away from the body first. Option C. Reaching across the sterile field with an unsterile sleeve. Option D. Keeping sterile items above waist level. The correct answer is option C. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile forceps can help maintain asepsis when used correctly. Opening the far flap first is a common way to avoid reaching over the field. Sterile items are generally kept in view and above waist level. Question 64. While working in an exam room, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A. Melatonin. Option B. Insulin. Option C. Estrogen. Option D. Thyroxine. The correct answer is option B. Insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Melatonin is associated with sleep-wake cycles. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Thyroxine is a thyroid hormone involved in metabolism. Question 65. During a women's health clinic, a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A. Hold the medication and notify the provider. Option B. Ask the patient to sign a form and give it anyway. Option C. Administer the medication because it was ordered. Option D. Change the medication to another drug independently. The correct answer is option A. Hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. A form does not make an unsafe medication appropriate. An order does not override a possible allergy. Medical assistants do not independently substitute medications. Question 66. In an electronic health record review, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A. Wait according to office protocol before measuring the oral temperature. Option B. Record the temperature as normal without measuring it. Option C. Switch to a rectal temperature without asking. Option D. Take the temperature immediately because oral readings are unaffected. The correct answer is option A. Wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Vital signs must be measured rather than assumed. Changing to an invasive route requires proper indication and protocol. Recent liquids can affect oral temperature results. Question 67. An office review in an urgent care office shows that a patient asks for printed medication instructions. Which practice improves health literacy? Option A, provide instructions in the wrong language. Option B, use only complex medical terminology. Option C, tell the patient to search online without guidance. Option D, use clear language and review the key points with the patient. The correct answer is option D. Use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Language mismatch can prevent safe understanding. Complex terms can reduce comprehension. Unguided online searching may provide inaccurate or confusing information. Question 68. While working in a clinical skills review, a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A, sterile technique. Option B, chain of custody. Option C, prior authorization. Option D, patient confidentiality. The correct answer is option D, patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Sterile technique concerns preventing contamination during procedures. Chain of custody concerns specimen handling documentation, not public conversations. Prior authorization concerns payer approval for services. Question 69. After reviewing the situation in a preventive care visit, a tickler file is used in the office. Which purpose does it serve? Option A, measure oxygen saturation. Option B, sterilize instruments. Option C, track future follow-ups or reminders. Option D, draw blood into tubes. The correct answer is option C, track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Oxygen saturation requires a pulse oximeter. Sterilization requires approved equipment and process. Blood collection uses phlebotomy supplies, not a reminder file. Question 70. Before the visit continues in a certification exam scenario, a patient has an advance directive in the chart. Which statement is most accurate? Option A. It communicates the patient's wishes about future medical care. Option B. It replaces all insurance forms. Option C. It allows the assistant to ignore provider orders. Option D. It is used only to schedule appointments. The correct answer is option A. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Advance directives do not replace billing or insurance documents. Care decisions still follow legal, clinical, and facility processes. Scheduling is unrelated to the purpose of an advance directive. Question 71. During a quality control review, the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A, place the gloves in a regular drawer. Option B, apply lotion instead of cleaning hands. Option C, perform hand hygiene. Option D, use the same gloves to clean the next room. The correct answer is option C, perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Used gloves are contaminated waste and should be discarded properly. Lotion does not replace hand hygiene. Gloves are task-specific and should not be reused between patients or areas. Question 72. To protect safety in a patient intake station, a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A, RACE. Option B, NPO. Option C, PRN. Option D, SOAP. The correct answer is option A, RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. NPO means nothing by mouth and is unrelated to fire safety. PRN means is needed and does not guide emergency fire response. SOAP is a documentation format and does not guide fire response. Question 73. While working in an administrative check-in area, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A, tell the patient not to call if symptoms worsen. Option B, review the provider-approved instructions and confirm understanding. Option C, create new instructions that contradict the provider. Option D, avoid documenting that instructions were given. The correct answer is option B. Review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach back to verify understanding. Patients should know when and how to seek help for concerning symptoms. Instructions should match the provider's plan and office protocol. Patient education should be documented according to policy. Question 74. Following office protocol in a community health clinic, a chain of custody urine drug screen is collected. Which practice is most important? Option A. Allow the patient to take the specimen home first. Option B. Skip signatures if the specimen looks normal. Option C. Use an unlabeled container until the lab receives it. Option D. Document each transfer and maintain specimen integrity. The correct answer is option D. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Uncontrolled possession breaks specimen integrity. Appearance does not replace custody documentation. Unlabeled specimens can be rejected and cannot be reliably traced. Question 75. The care team in a specialty referral visit asks for guidance because the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A. Prior authorization. Option B. Wave scheduling. Option C. Stream scheduling. Option D. Matrix blocking. The correct answer is option B. Wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Prior authorization is payer approval and is not a scheduling method. Stream scheduling assigns patients specific individual appointment times. Matrix blocking reserves time unavailable for patient appointments. Question 76. During an outpatient laboratory, a pelvic examination is scheduled. Which patient position is commonly used? Option A. Lithotomy. Option B. Prone. Option C. Trendelenburg. Option D. Sims. The correct answer is option A. Lithotomy. The lithotomy position is commonly used for pelvic examinations. Prone means lying face down and is not the common pelvic exam position. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Sims position is often used for rectal procedures or enemas. Question 77. Before the visit continues in a medical office workflow, a subcutaneous injection is ordered. Which site is commonly appropriate? Option A. Directly into a vein. Option B. Deep into the deltoid muscle only. Option C. Into an area that is bruised and inflamed. Option D. Abdomen with adequate subcutaneous tissue. The correct answer is option D. Abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. Intravenous administration is a different route and is outside a subcutaneous injection. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Bruised or inflamed tissue should generally be avoided. Question 78. As part of exam preparation in an outpatient laboratory, a patient asks why a medication is placed under the tongue. Which route is being described? Option A. Sublingual. Option B. Otic. Option C. Ophthalmic. Option D. Topical. The correct answer is option A. Sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Otic medications are placed in the ear. Ophthalmic medications are used in the eye. Topical medications are applied to the skin or surface tissues. Question 79. When a patient encounter unfolds in a treatment room, muscle tremor artifact appears on an electrocardiogram tracing. Which intervention may improve the tracing? Option A. Help the patient relax and support the limbs. Option B. Ask the patient to tense all muscles. Option C. Remove all electrodes during the recording. Option D. Place the paper speed at 0. The correct answer is option A. Help the patient relax and support the limbs. Muscle tension and movement can create artifact, so comfort and support may improve tracing quality. Tensing muscles increases electrical artifact. Electrodes are required to capture the tracing. Paper movement is needed to record the waveform. Question 80. During a certification exam scenario, the term dermatology appears in a referral. Which specialty is involved? Option A. Heart. Option B. Blood. Option C. Kidney. Option D. Skin. The correct answer is option D. Skin. Dermatology is the specialty focused on skin conditions. Cardiology focuses on the heart. Hematology focuses on blood and blood disorders. Nephrology focuses on the kidneys. Question 81. While working in an infection control audit, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A, skip the explanation if the patient nods. Option B, ask a young child to interpret. Option C, speak louder and slower in English only. Option D, use a qualified medical interpreter. The correct answer is option D, use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Nodding does not prove understanding or valid communication. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Volume does not remove a language barrier. Question 82. After reviewing the situation in a pediatric clinic, a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A, promise that the provider will not be concerned. Option B, ignore the anxiety to avoid making it worse. Option C, tell the patient the reading is probably wrong. Option D, acknowledge the concern and explain the procedure in simple terms. The correct answer is option D, acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Promising an outcome goes beyond the assistant role and may be inaccurate. Ignoring patient concerns can increase anxiety and weaken communication. Dismissing the result can reduce confidence and may be clinically misleading. Question 83. Before the visit continues in an administrative check-in area, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A, ignore the medication order completely without communication. Option B, ask another patient what the abbreviation means. Option C, clarify the order before proceeding. Option D, interpret the abbreviation however it seems most likely. The correct answer is option C, clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. The order should be clarified rather than silently ignored. Patients are not appropriate sources for interpreting orders. Guessing can lead to serious medication errors. Question 84. For a patient encounter in an exam room, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A, adjustment. Option B, premium. Option C, deductible. Option D, copayment. The correct answer is option D, copayment. A copayment is a fixed amount the patient pays for a covered service. An adjustment changes the billed amount based on contracts or corrections. A premium is the amount paid to maintain insurance coverage. A deductible is the amount the patient pays before insurance begins paying according to the plan. Question 85. A medical assistant is working in a family practice clinic when the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A, atrial repolarization only as the visible main event. Option B, ventricular depolarization. Option C, ventricular filling with blood only. Option D, a lung gas exchange. The correct answer is option B, ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Atrial repolarization is usually hidden within the QRS complex. Mechanical filling is not the primary electrical event represented by QRS. Gas exchange occurs in the alveoli, not on the QRS waveform. Question 86. As part of exam preparation in a diagnostic testing area, an intradermal test is being prepared. Which description matches the route? Option A, medication placed into the ear canal. Option B, injection just under the epidermis to form a small wheal. Option C, injection into deep muscle tissue. Option D, medication swallowed by mouth. The correct answer is option B, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Ear canal administration is otic. Deep muscle injection is intramuscular. Swallowed medication is oral administration. Question 87. In a patient intake station, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A, place the patient beside an immunocompromised patient. Option B, use only sterile gloves without a mask. Option C, skip precautions if the patient is already taking medication. Option D. Apply droplet precautions and offer a mask according to protocol. The correct answer is option D. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Separating symptomatic patients helps reduce transmission risk. Sterile gloves do not protect mucous membranes from respiratory droplets. Treatment does not remove the need for appropriate precautions. Question 88. Before the visit continues in a patient intake station, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A. Maintain required temperature storage and check expiration before use. Option B. Store it in a desk drawer overnight. Option C. Place it in direct sunlight to warm quickly. Option D. Use it after expiration if it looks clear. The correct answer is option A. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Room temperature storage can damage refrigerated products. Sunlight and heat can damage the product. Appearance does not prove potency after expiration. Question 89. A medical assistant is working in a cardiology practice when a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Ask the patient to jump to the table. Option B. Leave the wheelchair unlocked for easier movement. Option C. Pull the patient by the arms quickly. Option D. Lock the wheelchair and use proper body mechanics with assistance as needed. The correct answer is option D. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Jumping is unsafe and unrealistic for a transfer. An unlocked wheelchair can roll and cause a fall. Pulling can injure the patient and the assistant. Question 90. In a patient intake station, the abbreviation NPO appears before a procedure. Which instruction does it represent? Option A. Nothing by mouth. Option B. New patient only. Option C. Normal pulse output. Option D. Nasal passage open. The correct answer is option A. Nothing by mouth. NPO means the patient should take nothing by mouth for the specified period. New patient only is not the meaning of NPO. NPO does not describe pulse measurement. NPO is not a nasal assessment abbreviation. Question 91. After reviewing the situation in a preventive care visit, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A. Clean and disinfect touched surfaces according to office protocol. Option B. Change only the paper on the exam table. Option C. Open the door to air out the room only. Option D. Spray disinfectant and wipe it off immediately every time. The correct answer is option A. Clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. The exam table paper does not address other touched surfaces. Ventilation alone does not remove organisms from contaminated surfaces. Disinfectants usually require the manufacturer's contact time to work properly. Question 92. For a patient encounter in a treatment room, a patient questions a medication that looks different from the usual dose. Which response is safest? Option A. Tell the patient that questions are not allowed. Option B. Give the medication quickly before the patient refuses. Option C. Pause administration and verify the order and medication. Option D. Document that the patient was difficult and continue. The correct answer is option C. Pause administration and verify the order and medication. A patient concern can identify a potential medication error, so verification is required before proceeding. Patients should be encouraged to participate in safety. Rushing increases risk and ignores a safety concern. Labeling the patient does not resolve the possible medication issue. Question 93. The care team in a patient education session asks for guidance because the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A. Air in the lungs. Option B. Sugar in the blood. Option C. Protein in the stool. Option D. The blood in the urine. The correct answer is option D. Blood in the urine. Hematuria means blood is present in the urine. Air in the lungs is not described by hematuria. Sugar in the blood is described by glycemia terms. Protein in stool is not hematuria. Question 94. After reviewing the situation in a treatment room, the assistant prepares instruments for suture removal. Which item is commonly needed? Option A, ophthalmoscope only. Option B, suture removal scissors or sterile scissors according to policy. Option C, tuning fork only. Option D, peak flow meter only. The correct answer is option B, suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. An ophthalmoscope is used to examine the eye, not remove sutures. A tuning fork may be used in hearing or vibration tests. A peak flow meter measures expiratory airflow and does not remove sutures. Question 95. The care team in a medical office workflow asks for guidance because the provider discusses gas exchange in the lungs. Which structure is primarily responsible? Option A, villi. Option B, tendons. Option C, alveoli. Option D, ureters. The correct answer is option C, alveoli. Alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged. Villi increase absorption in the small intestine. Tendons connect muscle to bone. Ureters carry urine from the kidneys to the bladder. Question 96. To protect safety in a women's health clinic, a rapid strep test requires a throat swab. Which technique is best? Option A, swab the outside of the lips. Option B, collect sputum from a deep cough. Option C, touch the tongue repeatedly to collect saliva. Option D, swab the tonsillar area and posterior pharynx while avoiding the tongue. The correct answer is option D, swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. The lips do not provide the specimen needed for strep testing. Sputum is not the specimen used for a rapid strep throat swab. Saliva and tongue contact can dilute or contaminate the specimen. Question 97. As part of exam preparation in a walk-in clinic, the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A, below normal or deficient. Option B, against. Option C, above normal. Option D, before. The correct answer is option A, below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Against is indicated by anti. Above normal is indicated by hyper. Before is indicated by pre. Question 98. An office review in a patient intake station shows that a claim requires the code for an office visit procedure or service. Which code set is used? Option A, ICD-10-CM. Option B, CPT. Option C, policy number. Option D, zip code. The correct answer is option B, CPT. CPT codes describe medical procedures and professional services. ICD-10-CM codes describe diagnoses and reasons for services. A policy number identifies insurance coverage and does not describe the service. A zip code identifies location and is not a procedure code. Question 99. When a patient encounter unfolds in an exam room, a patient requests an appointment reminder by text message. Which consideration is important? Option A, ignore all reminder preferences. Option B, text any diagnosis to any phone number in the chart. Option C, post the reminder on social media. Option D, follow office policy and patient communication preferences. The correct answer is option D, follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Preferences help guide appropriate communication. Sensitive information and wrong numbers can create privacy risk. Public posting would expose private information. Question 100. A medical assistant is working in a family practice clinic when a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A, remittance address. Option B, coinsurance. Option C, referral. Option D, copayment. The correct answer is option B, coinsurance. Coinsurance is the patient's percentage share of covered costs. A remittance address tells where payments or documents are sent. A referral is permission or direction to see another provider. A copayment is usually a fixed amount rather than a percentage.